I have a small request. Please switch on your video so that I can able to see you uh, while I am teaching. If possible, please. Thank you. So let me share my screen. So I hope my screen is visible to everyone. So lymphedema. So I think all of you are at least have seen one patient at least from your career. So we all know that what is lymphedema. So lymphedema is related to lymphatic system. So lymphatic system is a part of circulatory system. So these all are connecting together. So we need to learn lymphatic system first. Then only we will understand about the lymphedema part. So before moving on to the lymphedema part, so I would like to ask you one question. What is lymph? Throughout the lymphatic system, lymphatic fluid is flowing. So what is lymph? Any idea? Please unmute yourself and talk, or you can put your answers in the chat box. Anything you want, you can. What is lymph? Anybody? Colorless fluid drains from tissue fluid. Okay, thank you. Thank you for your answers. So it is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries. Then it enters to the lymphatic vessels. Then it enters to lymph nodes. So it contains protein and mainly protein, lipids and water. So this is called lymph. So it is a tissue fluid or an interstitial fluid. So what are the functions of lymphatic system? There are three major functions of lymphatic system. One is reabsorb excess interstitial fluid. So wherever the lymphatic fluid is collected, especially into the interstitial space, the lymphatic capillaries will be absorb the lymphatic fluid from the interstitial space so that the fluid and electrolyte balance will be maintaining well, because otherwise our body will full of edema like anasarca. Okay. So because of the capillary that lymphatic capillaries connection, the all excess lymphatic fluids absorbed from the lymphatic interstitial space. Okay, so that is the major functions of the lymphatic system. And the second function is transport dietary lipids. So I'll come to you later on transport dietary lipids. And the third important, very, very important function is lymphocyte development and the immune response. If there is any problems happen in one area, like on axilla, maybe on groin, that part is a major lymph node is affected. That part will be completely that the is a no lymph node is there to fight against bacteria. Okay, so that area is prone to develop infection. So these are the major functions of lymphatic system. Coming to the systemic circulation. So we all know that this is systemic circulation. So from our upper part of the body, the superior vena cava collect the deoxygenated blood into the right atrium, and the lower part of the body, inferior vena cava, so will be collecting the deoxygenated blood, and then it will drain into the right atrium. So this is how the systemic circulation works. Then from right atrium it goes to right ventricle. From the right ventricle, with the help of pulmonary artery, that blood will goes to the right and left lungs for purification of blood, because the deoxygenated blood get purified from the lungs. So what happened there? You can just see there are communication between the arterial capillaries and the venous capillaries. Okay, so when the arterial capillaries and the venous capillaries are communicating together, what happened? So there is a leakage of fluid-like materials into the interstitial space. Okay, so that fluid is called lymph. Okay, so coming to the interstitial space, as I mentioned earlier, wherever the the venous capillaries and the lymphatic capillaries are communicating together, there is a small leakage of fluid-like materials into the interstitial space. That is called, that is, you can just see the greenish color, that is lymphatic fluid. So that the lymphatic capillary, that is lymphatic capillaries. So wherever the lymphatic fluid is leakage, so the lymphatic capillaries will be absorb the lymphatic fluid from the interstitial space. Okay, is it clear? Anybody wants to needs clarify regarding this? So we need to learn, this is very important, where is origin and how the lymphatic fluid origin. These all things you should know. Is it clear? Please respond. Okay, thank you. Thank you, Priyanka. So next is lymphatic capillaries. So as I mentioned earlier, the lymphatic capillaries will be there in the interstitial space, and will be that is all look like the overlapping of endothelial cells. It has a blind end, more permeable than that of blood capillaries. So this is the structure of the lymphatic capillaries. Because of this, so the lymphatic capillaries are more easily to absorb the lymphatic fluid from the interstitial space, because this is more permeable. So that lymphatic capillaries are very easy to absorb the fluid from the interstitial space. Because just imagine a glass of water pour in the floor. If you take a cotton roll and put it into the water, so what happened? The cotton ball will be absorbing all the water from the floor, no? So this is how the lymphatic capillary is working. So wherever the lymphatic capillaries are there, the interstitial that fluid will be absorbing from the help of lymphatic capillaries. Coming to the lymphatic capillaries in the lacteals, because in our, so I had mentioned about there are the second major functions of lymphatic system is to transport dietary lipids. So in our small intestine contains the special type of capillaries called the lacteals. So lacteals just pick up the interstitial fluid, but also they pick up the dietary lipids and the lipid soluble vitamins from the small intestine. So because that kind of area, that lymphatic fluids that look like saccharine, because milky color will be there due to the lipid. Coming to the lymph node. So we learned about the lymphatic capillaries. We learned about the lacteals, and now we are going to learn about lymph nodes. So these are the lymph nodes is running a major role in our system, because it was a lot. We have around 600 to 700 lymph nodes in our body. So it has a small round oval shape, and it has located along the pathways of lymph vessels. So it has 6 to 25 millimeters length, and typically found in clusters. So receive the major functions of lymph node is receive lymph from the many body regions, and it will help to filter out the harmful substance from the lymphatic fluid. So now, how the lymphatic system works. So I already talked about the anatomy of the lymphatic system, the major functions of lymphatic system. Now, I already mentioned about the lymphatic fluids. So the lymph is a protein-rich fluid. So in our lymphatic system circulate protein-rich lymphatic fluids. Okay, it might be contains bacteria, virus, and waste products. Okay, not all the times. It might be contains bacteria, virus, and waste products. You have to keep it in mind all the times. Sometimes these kind of that infectious things will be there in the lymphatic system. So what happened when the lymphatic capillaries are absorbed from these kind of protein-rich lymphatic fluids into the interstitial space, then it goes to the lymphatic vessels. So throughout the lymphatic vessels, there will be a lymph node. So what is the major functions of lymph node? So lymph node will be filter out the harmful substance from the lymphatic fluid. So this is the major functions of lymph node. So this will help to filter out the harmful substance from the lymphatic fluid, like interstitial fluid. So after that, the waste are flushed from the body, and clean lymphatic fluid drain into the bloodstream. So this is how the lymphatic system works. Okay. Coming to the pathophysiology, as I mentioned earlier, when the lymphatic capillaries are absorbed fluid from the interstitial space, it goes to the lymphatic vessel. Then it again goes to the lymph node for filtering out harmful substance from the lymphatic fluids. Again, it goes to the lymphatic vessel. Again, it goes to lymph node, and then lymphatic trunk and collecting drug. Through that, finally, it goes to subclavian vein. So if it will goes to the subclavian vein, again, it's our systemic circulation. That's why we always says the lymphatic system is also a part of circulatory system. So now we are going to learn about lymphedema. What is lymphedema? Lymphedema is a pathological accumulation of protein-rich fluid into the interstitial space due to an imbalance between interstitial fluid production and transport. What happens if there is a lymphedema? If there is any damage into the lymph node happen, what is the next? So there is no way to lymphatic fluids go up. So there will be the difficult transportation happen there, because the production will be there, because wherever the arterial capillaries and venous capillaries are communicating together, definitely the fluid leakage will be there. That lymphatic fluids will be there, but the transportation is damaged. So that time, so edema, the hand will be that affected area will be edematous. That is called lymphedema. So lymphedema is a pathological accumulation of protein-rich fluid into the interstitial space due to an imbalance between the interstitial fluid production and transport. So there are two major classifications, the primary and secondary. Primary is congenital lymphatic dysplasia because from the birth itself there will be a malformation there is that comes under in primary lymphedema. So the secondary lymphedema is anatomical obliteration of the lymphatic system. So now our lymphatic systems are work well, and so if there is maybe after 2 days, we don't know what is happening in our body or not. If there is any major accident or any tumor, anything happen in our body, definitely there is a anatomical obliteration will be there. So based on that, there will be again divided into two. The secondary lymphedema divided into non-malignant and malignant. So from this slide, you have to understand that so non-malignant persons can also develop lymphedema. Okay. So what is that? The non-malignant person means trauma, major road traffic accidents. Because of that, the maybe inguinal node can damage, and the axillary node can damage. So these kind of major lymph nodes damage into their road traffic accident. So gradually, maybe later, after 3 or 4 months, the patients can develop lymphedema. And the second one is infection, recurrent infection like cellulitis. So that patient also can develop lymphedema. The third one is iatrogenic surgery and radiotherapy. If you do the surgery, definitely cancer patients, you can just imagine a CA breast patient. We need to remove the breast mass. So when we remove the breast mass like mastectomy, we will do the total mastectomy. What is total mastectomy? So we will remove the adjacent lymph nodes too. So if we remove the lymph nodes, adjacent lymph nodes, what happens? There is no lymph node in their axilla. So there is a chance of pooling of fluid into their affected arm. So that patients can develop lymphedema later. And coming to the malignant, primary lymphomas and secondary recurrence also. So these are the classifications of lymphedema. Coming to the diagnosis. So we know not all edema is lymphedema. Renal problem patients can develop pedal edema. And cardiac problem, if the patient is having some cardiac issues, that patient also can develop lower leg edema. So these all things you have to keep it in mind. If a patient is complaining of that edema, and especially into their lower legs, you have to take a proper history. So whenever you have seen a patient with these kind of edema, any kind of edema, your first duty to take a proper history. And when you take a history, you have to ask them whether there is any, find out whether there is an unknown cause, and is there any related to disease related or trauma related and treatment related. So these are 3 points you have to keep it in mind when we taking history. Okay. And the second major point is clinical examination. When we are taking the history, proper history, then you will get an idea about what kind of edema it is. Then definitely you have to do the clinical examination. So if you from the patient history, you understand that whether the patient is having lymphedema or not. If the lymphedema, if you finalize this patient is having lymphedema, then the stage is 3. The 3 stages are there. The first stage is pitting edema stage. So like a orange peel skin. Okay. When you apply pressure on that area, your finger point is visible. So that is stage 1. So this stage we can manage easily. But if you are not that manage this stage, it goes to the second stage, that is fibrotic, little bit harden also, no longer soft. Also, like creases, sometimes creases will be there. So this is very difficult to manage, but we will try to reduce their edema as much as we can. And if you are not giving proper attention in second stage also, in then it goes to third stage. That time the tissues are considerably hard and cartilage formation will be there. More creases will be there. So because creases, if there is creases developed, there is a chance of dirt accumulating in between the creases, and then the patients can develop infections like cellulitis. All those things will develop. Coming to the again the one sign is stemmer sign. So this is the only sign which we have seen in lymphedema patient. For a healthy persons, we can able to fold our that we can able to pinch or lift up the base of the second toe or the middle finger of the upper limb. So for a healthy person, but if the patient is having lymphedema, we cannot. Okay, so this is called stemmer sign. For a normal person, we can able to lift up the base of the second toe skin or the middle finger, the skin. So for there is a upper limb lymphedema. But if the patient is having lymphedema, we are not able to raise these kind of these two areas, that skin. So this is the positive sign of lymphedema. Coming to the other diagnostic methodologies, because these all things you should know from the, if there is a primary lymphedema there, we need to find out whether there is any abnormalities, and we have to find out what kind that measure, we have to find out what the volume or the how much extra volume is there, and we need to measure the interstitial volume. These all things we need to find out. So for that, you can do soft tissue imaging like MRI, CT, lymph vessel imaging, bioimpedance spectroscopy. These all things you can do for find out whether there is any abnormalities happening into their lymphatic system. So that we can able to manage it. So if you find out the cause, we can able to manage as well. And coming to the problems. So there are a lot of problems. Just imagine one limb is normal and the another one is huge. So we are not able to lift up. So just imagine a patient with these kind of lymphedema in your OP. Maybe you are working in an OPD nurse in front of you. These kind of patients will be there. So what kind of problems will be there? Pain will be there, discomfort will be there, because our skin will be stretched a maximum. So after that, skins are not able to stretch us more than enough. That time, the patients can experience pain and discomfort. Tightness will be there, and heaviness. They will be feeling heaviness and fatigue, numbness, in the inward mobility, because they are not able to move their limbs independently because of the fluid volume, loss of function. So these all things will be affecting them a lot, because these are the physical problems. This will be affecting the patient emotionally, socially, and spiritually too. Coming to the psychosocial problems, body image. So one limb is normal, and another one is huge. So this will be affecting the patient a lot, because nobody is exposed their these kind of limb in the public. So they always I have seen many patients like this, because whenever the lymphedema patients come to our OPD, they will cover their affected limb with the clothes. So nobody wants to see their affected limbs to the public. So that will be affecting the, because if they expose to the public what happened, everyone will be asking them what happened. So this again they will be answering a lot, and this will be affected because of this edema, that they will be asking like that. So they will be affecting emotionally, socially, and spiritually too. Why God punished me like this? What was so these what happened to me? And these kind of that questions will be there inside the mind all the times, and loss of independence too. So because they are not able to work independently, because if they want to take anything from the cupboard, no, not able to take it. So they need a help. So because of the disease, they will be dependent others. So and sometimes loss and change of employment, they are not able to, because of the disease, they are not able to continue the same job, and difficulty in wearing clothes and shoes. So because ready-made, just imagine a ready-made clothes and shoes. One there are that's similar, no? So here one limb is no abnormal, one limb is normal. So they are not able to wear these kind of clothes and shoes, and they will be anxious and depressed. Why this has happened to me, and what is next? These kind of questions will be there. Social isolation will be there because nobody is willing. These kind of problems develop. They will be inside the that room all the times. They will not that because when they come out, everybody is asking their limbs, because of that they will be into the family all the times, and constant remainder of disease also, because if they have developed these kind, we all know that because of the lymphedema, axillary dissection, or lymph node problems, so the patients can develop lymphedema. We all know that, but the patient doesn't know. So when a patient comes to you with lymphedema, definitely their mind, their inside mind has these kind of that questions. Whether my disease is spreading to my hand, these kind of questions will be there all the time. So I have seen many patients like this. When we talk to them, they will be asking. So if we listen freely to their problems, definitely they will ask us. So whether my disease is spreading to my breast to that hand, these kind of questions will be there. So what you can do is, you have to listen their worries first, and then you have to make them understand that what is lymphedema. So because of the lymphedema, the lymph node dissection, the lymphedema can happen. These kind of the things you have to tell them and make them understand well what is lymphedema. And so now we know what is lymphedema, how to assess lymphedema. Now we are going to manage. We need to manage these kind of patients. How can we manage? There are four principles of management. One is skin care. The second one is massage. Third one is compression bandaging. The fourth one is exercise. These are the three principles of management of lymphedema. And the fifth one is intermittent pneumatic compression pump. So skincare, I'll come to that later. Skincare. So before doing the management part, you have to take a proper measurement, because one limb is normal, the another one is edematous. You have to, when if you see a patient in the first time, you have to take both limbs. Then only we can able to find out whether the limb is the because the edematous circumcision, no, so we have to take the measurement, and then when we take a circumference, then we can able to find out how much volume is increasing than that of the affected limb. So because that normal limb, so you have to take a proper measurement. When we take a measurement first, you have to take affected limb and the non-affected limb. When we take a measurement for an upper limb, you can take a measurement from the head of the ulna plus 2 centimeters, then again every 4 centimeter. So I have a video on that. I'll show you to later. So then you can able to see it well. So here you have to just that keep it in mind. For the upper limb, the head of the ulna plus 2 centimeter, then every 4 centimeter. You have to mark it first and then you can take a circumference. And for the lower limb, the angle from the angle joint plus 2 centimeter, then every 4 centimeter. You have to mark it first and then you have to take circumference and have to document it well into the case sheet. Coming to the skin care. So I already said if there is any lymph node, the dissection there is no lymph node. If, so where the lymphatic fluids, because from the interstitial fluid, the interstitial fluid might be contains bacteria, virus, some waste products. Okay. Definitely the waste products will be there, the waste materials will be there into the interstitial space, but in the interstitials, the capillary, the lymphatic capillaries will be absorbing the lymphatic fluid from this kind of fluid from the interstitial space, no? So that will be goes to the lymph node for filtering out of harmful substance. Here you have to imagine there is no lymph node, no filter, no not able to filtering out the harmful substance. What happened? The patients can develop easily, can develop infections like cellulitis. So we have to give a special attention on that affected area. Always you have to tell them apply some simple moisturizing cream. So just after the bathing. So not just before the massaging, just after the bathing, they can apply some simple moisturizing cream so that we can able to prevent dryness and meticulous that drying between the digits. So that is also very, very important because there is sometimes because of the edema, the in between the digits, there is a accumulation of dirt will be there. So if there is a accumulation of dirt there, what happened? Fungal infections can develop. Avoid injections and veiny pinches. So if there is a nothing, sometimes nothing happened, but if there is a not that unsterile practice there, definitely the patients can develop cellulitis. So I think better you can avoid injections and veiny pincher, that kind of area. Avoid suicides and avoid blood pressure cuffs. So these will all affect the collaterals. Avoid injury. All so if the females, if just for a females, they are not able to sit proper, sit into the corner. So always they want to work in kitchen. They need to prepare food for the family. So because of that, you have to give a proper instruction to them. If there is maximum, they will try to avoid injury. If there is accidental cut happen, what is the next they have to do? So they have to clean that area and keep the area clean. And they have to identify whether there is any signs and symptoms of infection. If there is any redness or any signs of infection there, definitely they have to take an antibiotics for that. Otherwise, cellulitis will be developed. So that kind of instructions you have to tell them clearly and avoid carrying heavy things. So if they're taking heavy things, what happened? What happened? So more pressure, no? More pressure. So if you take more pressure there, what happened? Our blood circulation will increase. If the blood circulation increase, more capillary filtration will be there. If the capillary filtration is increased, what happened? The lymphatic fluids will be drained along. So these the more edema can develop. So better they can avoid carrying heavy things. Coming to the massage, there are two different types of massage: manual lymphatic drainage and the simple lymphatic drainage. Okay. So whenever you can, the manual lymphatic drainage is doing a trained practitioner. Okay, like a physiotherapist or a nurse or a doctor can do the manual lymphatic drainage, because we all know that how much pressure is needed for moving a fluid from the interstitial space to one space to another. Okay, so because the if you teach the patient and caregivers for this manual lymphatic drainage, when they go back, they will give more pressure on that affected area, that patients can develop more edema later on. So better they will not touch the affected area. So they can do the simple lymphatic drainage instead of manual lymphatic drainage. If you do the manual lymphatic drainage, start with a deep breathing exercise. So if you ask the patient to take a deep breathing exercise, if they take a deep breathing exercise, what happens? All lymph nodes will be stimulated, because I already said 600 to 700 lymph nodes in our body or into the lymphatic vessels, and the pathway of lymphatic vessel. There are lot of lymph nodes. So if you take a deep breathing exercise, definitely the internal lymph nodes will be stimulated, and they are get ready to receive the extra fluid. And then you can stimulate the superficial lymph node. Wherever you can stimulate the superficial lymph node, like neck, axilla, groin, these all the superficial. There are lot of superficial lymph nodes are there. So you can stimulate that and massage the proximal part first, and then go to the distal part. You have to clear the proximal area first, and then go to the distal area. Always you have to use a gentle pressure. Okay. This is how we used to give the manual lymphatic drainage. We have a video on that. We will show it to you now, and then we will look into the contraindications.
Management of lymphedema of the arm. Part 1. Manual lymphatic drainage or massage. Gemma is suffering from breast cancer and has developed lymphedema on her right arm. She has been admitted to the hospital for the management of lymphedema. Lymphedema is a condition in which excess fluid called lymph collects in tissues of the body and causes swelling. 4 common steps of management of
Thank you. Hope you understand well. Any doubts regarding this video, please ask now. Anything you want to ask me regarding the manual lymphatic drainage? So there are a few contraindications of manual lymphatic drainage. Acute cellulitis. If the patient is having acute cellulitis, there will be pain, infections, lot of problems will be there. Because of that, you won't do that management, that this kind of manual lymphatic drainage. You have to, that time you have to try to reduce their infection, control their infection with the help of amoxicillin tablets, that kind of things. And then renal failure. So if the patient is having renal failure, the patient is not a good person for giving manual lymphatic drainage, because if you push fluid from an affected limb to the non-affected area, because the fluid overload can happen. So because of that, we don't recommend it for the patients who are with renal failure and unstable hypertension. Again, the same things: severe cardiac insufficiency, hepatic cirrhosis with ascites, superior vena cava obstruction. So these are the contraindication, because we are for a patient with lymphedema, definitely our aim is to push the fluid from the congested area to the non-congested area. If the other area is well, we can able to do it. Otherwise, that will be affecting the problems. Other problems, because if they have unstable hypertension and cardiac problems, or a superior vena cava obstruction there, so this will affecting the patient a lot. So these kind of things you have to find out before you are doing manual lymphatic drainage. Any doubts? Manual lymphatic drainage. So if you don't have any doubts, I'm moving to the next. You have to do the manual lymphatic drainage, and then you can train the patient to man the bandaging, because initially we will do the spiral bandaging for 2 weeks. If the for 1 week or 2 weeks, if they are able, if they are tolerate the spiral bandage, then we will move on to the figure of weight bandage. Okay, so for the lower leg also, the same thing. Try to manage the patient with spiral bandaging first, and then if they are able to tolerate with the spiral bandaging, then we will move on to the figure of eight bandages, so that the patient's the edematous area will get more pressure, and because of that pressure, the fluid will move from the affected area to the non-affected area. So this is how bandaging. So again, we have a video on that, and we will show it to you that bandaging part, and then I will take few questions. Any doubts? So next thing is there are the final thing is exercise. So you already watched in the video exercise and elevation. So after the bandaging, you can educate the patient and encourage the patient for some kind of simple exercise, so that all the fluids can drain up from the congested area to the non-congested area, and after that they can that elevate the limbs with the help of a pillow. And coming to the intermittent pneumatic compression pump, this is, I think, I don't know how many of you have seen these kind of things. This will help the patient with lymphedema stage 1. This is a small plastic, this is a plastic garment like that, that inflatable things. You can, affected limb, you can put it into that, part, and then we have a machine, and we can able to adjust the pressure and duration, so that the continuous pressure, like a BP cuff. When we take the blood pressure, what happen? The pressure will that increasing when we that cuff is that on that the BP cuff, the blood pressure cuff will be tightening in your that area, na? So while we taking the blood pressure, so the same things for that lymphedema area, there will be a continuous pressure. We can able to adjust into the machine, so that our aim is to push the fluid from the that affected area to the non-affected area. There are two major complications. One is the cellulitis, and the another one is lymphoria. The cellulitis, we all know that cellulitis is a acute inflammatory episode. So if there is a, sorry. So if there is a cellulitis there, you have to educate the patient to take the antibiotics for that. They have to meet a physician and they take proper antibiotics for that. So otherwise, it will that it will maybe another create another problem. So if the patient is having any signs and symptoms of inflammation, definitely they will take antibiotics for that. And the second one is lymphoria. Lymphoria is leakage of lymphatic fluid from the lymphedema site. For that, you can apply, you can put that dressing pad on that area, and just put a bandaging to that area, so that all the extra fluids will leak out. So this is how the lymphoria managed. But if the patient is having cellulitis, you don't wear any kind of active that bandaging, and don't give any that active management for lymphedema. Once the lymphedema, the cellulitis comes down, then you can do the active management. But in case of lymphodia, you can apply that non-adherent dressings and apply pressure bandages like crepe bandages. So that when we apply crepe bandages, it will give a more pressure on that area so that all fluids will come out. Any doubts regarding lymphedema? Please ask. Anything? So this is my end of the class. So please switch on your videos and ask few doubts. Anybody? Please switch on your videos. Any doubts about lymphedema? Any questions? Please ask some questions because we all nurses know. No questions. If you don't have any questions, I will ask many questions.
If there is an emergency, hand.
Sister Sindhu, your voice is breaking. Please, hello, Sister Sindhu, can you repeat the question? Your voice is breaking.
Ma'am, if there is an emergency situation, can we put any IV line on that limb?
No, it is not advisable. It is not advisable. So some of the places the nurses can give injections and venipuration, but the thing is if there is any sign like infections, definitely the at the end cellulitis. There is no lymph node, there is no resistance. So definitely the patients can develop cellulitis. So better you can avoid that area. Always, whenever we have seen these kind of patients, we will tell them whenever you go to the hospital, you have to tell the nurses, I'm having lymphedema, these kind of, but the nurses doesn't know, no. So you have to tell them, I am having lymphedema. I have removed the axillary lymph node from my axilla. So these kind of things you have to tell the nurses. Then only the nurses know that. So, but our nurses should know that lymphedema hand we should not prick. Blood pressure checking is prescribed in. So, blood pressure in an emergency situations you can, but if possible you can avoid that. Again, it will affect the collaterals. Any other questions? Is the lymphedema is curable or not? Question to you. If a patient comes to you with it is not curable, Dina said it is not curable. Any other answers? It is not curable. Priyanka said again not curable. Vinesha said not curable. Okay, not curable. I am agree with that. So why? Why you are telling not curable? So Ashwaji said it can reduce but not curable. So why you are saying not curable? So your answer is correct. Like Ashwati said, we can try to reduce their edema, but not completely cure because, as you all mentioned, because wherever the arterial and that arterial capillaries and the venous capillaries are communicating together, definitely the fluid will leaking out. No, so the fluid collection will be happening all the time. So there is no curable wherever the fluid leak is there. The edema will expect. We have to expect the edema, but if there is a good lymph node lymphatic circulation there, there will not be have any lymphedema. But if there is any lymph node dissections or damage there, definitely the patients can develop lymphedema. So this is not curable, but you have to tell them we can able to control the edema as much as we can. These are the way we can able to control the edema, like skin care, the manual lymphatic drainage, simple lymphatic drainage, and exercise. So coming to the simple lymphatic drainage, for the simple lymphatic drainage, the patient not the touch the not able to, because we have to give a special that instruction to the patient and caregivers. They should not touch the affected limb because, as I mentioned earlier, they don't know how much pressure is need for moving the fluid from one space to the next place. So we all know that the fluid is into the interstitial space. The small pressure is enough. But when if you teach the caregivers or patient, they will give more pressure so that more fluid accumulation will be there. So that better they should not touch the affected limb, but they can wear that lymphedema bandaging. They can that put lymphedema bandage, that crepe bandaging, and they can that take a deep breathing exercise. They can able to stimulate the superficial lymph node, and also they can do the exercise. Again, they can do the deep breathing exercise and elevate the lymph and that take rest at least an hour, so that the lymphatic fluid, the lymphedema can reduce. So they should not touch the affected limb. That is the difference from the manual lymphatic drainage and the simple lymphatic drainage. For the manual lymphatic drainage, it will be done by a trained practitioner like a physiotherapist, nurses, or doctor. We all know that how much pressure is enough apply for that area. So for the simple lymphatic drainage, the patient should not touch the affected area or other things they can do. That is the difference between the manual lymphatic drainage and the simple lymphatic drainage. Thank you. So I think we can move on to the case presentation. In the meantime, if you have any questions, please put it into the chat box. Deepali, right? Deepali?
Yes, ma'am.
Yes, over to you.
Good afternoon, all. Myself, Dipali Ripote, and today is a case presentation of lymphatic edema. My patient is 45 years old and she is diagnosed with the CA breast with brain and lung metastasis, and she is having lymphedema in her right hand. Present complaints of my patient is pain in chest, left breast since 2 years back, change in breast shape and size since 2 years. She has breathlessness since 15 days and the loss of appetite since 2 months, weakness since 1 month, and convulsion since 15 days. She has nausea and vomiting and wound at the left breast nipple region. History of illness. Patient well before 5 years back. She has a lump in the breast left and redness in nipple, change in shape and size, and nipple and the breast lips left side. That she is taking treatment in the local area. Then pain can increase and not change in lump. Lump can increase. Then taking treatment at Sasun Hospital in Pune. Then surgery is done at Sasun Hospital. Then she taking chemotherapy in Sasun Hospital. Then recurrence after 3 years and having wound at left breast. Examination, self breast examination done, lump present in left breast, change in shape and size of nipple in the breast, change in left hand having lymphedema in left hand, wound at left breast nipple region. Treatment, taking chemotherapy 4 cycle after that surgery. Surgery is done mastectomy and having blood tests, CBC, creat, LFT, RFT, and PET scan done. A psychosocial aspect, patient is taking treatment 5 years. So family having financial problem, patient is living in Pakka house. Son and husband is working in company. She is a housewife having difficulty in daily living activities due to weakness, less of power, motor activity. Need to help to final support, need help to psychological support. Medication, patient is having medication, tab dexamethasone BD, tablet morphine 10 mg 4 QH, tab levipril BD, tab Imset 4 mg, and tab gabapentin 100 mg TDS for the pain management. Main concern, the patient having lymphedema, so having heaviness in hand, pain in the hand, left hand, and immobilization, having difficulty in daily activities, patient having convulsion, so giving nursing care by the staff, patient is having vomiting, so before meal giving tablet Imset 4 mg, patient is having difficulty in breathing, so oxygen support is provided to the patient. To avoid bed sore, position change 2 hourly, bed making done properly, to avoid any injury, fall risk, side rails up, to use wheelchair for mobility. All medication given as per the drug chart. Summary, 45 years old female patient diagnosed with the cancer of left breast and brain and lung metastasis, having wound at a left breast and pain in chest region and headache, having lymphedema at the left breast side and left hand, taking treatment in Sasun Hospital and the Bharti Hospital. Now she is admitted with chief complaints for breathlessness, pain, wound management, nausea, vomiting, and symptom management, having convulsions. Discussion points. Cancer of breast, change in shape and size breast, wound at the left breast, and wound management done. Wound dressing done with the syrup Sucrachem pack applied for patient having bleeding during the change dressing time. Patient having severe nausea and vomiting, so tabs IMSET 4 mg given as per the doctor's order. Lymphedema present at left breast and the glycerin max self dressing applied twice. Position change to uh, avoid bed sore. Intake output chart and maintain the intake output chart. Convulsions, so taking care of patient to avoid injury during the convulsions, giving mouth gag. Provide daily care to the patient.
Thank you, Deepali, for the wonderful presentation. Anybody need any more clarification regarding this patient story? Please ask her. Otherwise, we can move on with the discussion points. Or we will discuss this patient story. Anybody need any more clarification? No. So I think this presentation is clear to everyone. Any Deepali, I would like to know where is the patient at right now? Is it in the Shipla palliative care?
She is before the 1 month, and now she is discharged. She is at home.
Oh, she is at home. Okay, good. So, what is the condition right now? Because she has a lot of problems, pain, breathlessness, convulsions, and all. So, so how is she now? Right now, did she get adequate pain relief with morphine, or is there any other problems? So, what was the discussion? So, what is the discussion points?
She has lots of pain because of the lymphedema. Then we give the 10 mg morphine. Then sometime we give the breakthrough dose.
Okay. So, from your point, I understand that the patient is now the patient was that with the severe pain, but the patient had severe pain, but now the pain is controlled, right?
Yes, madam.
Now the pain is controlled with 10 milligram morphine, and now the patient is in home, right?
Yes, madam.
Okay. Okay. Is there any specific questions you want to ask us regarding this patient story? What about the lymphedema? Did you manage, or anything you had done for lymphedema?
Lymphedema, for the lymphedema in Cipla palliative care, we done the glycerin max self and magnesium sulfate dressing BD
For lymphedema.
for lymphedema.
Oh,
The action is hygroscopic.
okay. So I don't have any experience on that. We usually give massage and bandaging, and advise the patient to give a small exercise and elevate elevate the limb, so that we can able to so here we have received good results for this lymphedema management, but I don't know how the these kind of things works well, and then I don't have any experience. What about others? Do you have any experience on that? Others, please respond. Anybody have any experience? So they are using glycerin Maxel dressings for lymphedema patients for controlling edema. So no. Rena is also using same thing, right? Okay. So I would like to know more about that. How does it work, and also because we don't that use these kind of things. That's why I'm so eagerly note the so understand this more. Thank you. Any other questions? So from this patient, we have to understand that there are a lot of problems. These patient is having pain, breathlessness, and convulsion. These all things. There are a lot of problems, physical problems. If they have a physical problems there, you have to try to reduce their physical problems first, and then you can do the with the lymphedema management. Okay, if they have pain, so try to reduce their pain first, and then you can move on to the lymphedema management. Otherwise, the patient won't be able to tolerate, and they are not will cooperate because of their pain, not the willingness, because of their physical problem, physical distress. They are not able to follow your instructions and all. Try to reduce their physical problems first, and then you can look into that lymphedema part. So definitely you have to tell the patient about the lymphedema, that massage, bandaging, that exercise and all. So definitely you can educate the patient with a deep breathing exercise and stimulate the superficial lymph node stimulation, and then they can able to put the bandagings, and you can educate the caregivers for putting the bandages, and also if they are affordable, you can think about the stockings. If the edema is unilateral, you can think about the stockings. And before doing the exercise, they have to wear the stockings, or they can wear the crepe bandage. After that, they can do the some little exercise, one for fingers and one for wrist and one for elbow and one for upper arm. So again, after that, they have to take a deep breathing exercise and elevate the limb with the pillow, so that the all extra fluid will drain down. So because that is how we train the patient for this way. So our aim is to reduce the fluid from the congested area to the non-congested area. Any other questions? Others, please respond something. If you have seen these kind of patients, is there any additional points you want to add? So, Deepali, what about the family? Who is the primary caregiver of this patient?
Husband is primary caregiver, and she has a daughter, but she is married.
Okay.
And son.
Okay. Did you train the patient with lymphedema bandaging? No.
Yes, ma'am.
You trained.
In the center, we have a physiotherapist.
Okay.
She gave the exercise and advise the elevation of the hand and bandaging.
Okay. So before you send back to their home, you train the patient for lymphedema managing, right?
Yes, ma'am.
Okay. You use lymphedema, that crepe bandages and all, right?
Yes, ma'am.
Okay. Any other last questions? What about vomiting? Vomiting
Vomiting is stop. Stop.
control.
We use the IMSET tablet.
Okay.
So vomiting is a stop, and
Okay.
patient and the relatives when having the willing for to go home and request to home, then we send home for the request of the patient, for the psychological support of the patient. She wants to go home, so we
Okay.
send to discharge.
Okay. So what was the cause of nausea and vomiting for this patient?
uh, but tablet she is on tablet morphine, so
Okay. So,
having
yeah, so most of the time, initial period, if we start morphine that for a new patient, for the 3 to 5 days, the patients might have developed nausea and vomiting. But gradually, it is self-limiting. It's not need for metoclopramide or we usually don't give MSIT. We usually give metoclopramide first, and then the vomiting is not controlled. We usually give haloperidol for that. And if a patient is coming with you with nausea, vomiting, we have to identify the cause first. This patient is on morphine, and maybe because of that, nausea vomiting will be there. And another problem, because that one of the most common mm, side effect is constipation, because the morphine constipate the side effect of morphine is constipation. Because of that, maybe the patients can develop severe constipation. Maybe because of that, patient can develop nausea, vomiting, and also brain mets is also there. So you have to identify the cause first, and then treat the patient, treat the symptom. So always try to identify the cause. Okay. I think we can stop here, and now anyway now the patient is in home and stable. Wherever you have seen a patient with lymphedema, please give a the instruction on skincare and that massaging, bandaging, and all. Before that, you have to make them understand that what is lymphedema. So, what are the ways to reduce lymphedema, and what are the special things they have to follow. That all things you have to educate them well. And there are two complications. One is cellulitis, and the another one is lymphoria. If the patient is having cellulitis, you don't do any active management for that time. You have to give an antibiotics for that, and control the infection first, and then you can do the management part. If the patient is having lymphoria, you have to cover the lymphoria site with a dressing pad and apply crab bandage on that area, so that all lymphatic fluid will drain out. So these are the two major complications. And from the patient history, you have to understand that there are a lot of problems there, and a lot of there are many ways to manage lymphedema. So wherever if the patient and caregivers can follow the instructions within the hospital, you have to train the caregivers for applying bandaging and other things, and so that the caregivers can help to the patient for wearing the bandages and all. So that we can able to reduce the lymphedema. So if the patient is having physical problems, try to reduce the physical problems first, and then go to the lymphedema management. Okay. Thank you, Deepali, for the wonderful presentation.
thank you, ma'am.
Thank you others for joining today. Thank you.
Thank you, Sheeba ma'am, for the informative sessions. Thank you, Dibali, for the case presentation. Thank you all for joining. I request you to fill the feedback form also. Let's see you in the next session. Thank you.